Hello everyone, my name is Lexi.
And I'm Billy.
And we're both Masters of Athletic Training students at Bellarmine University.
Go Knights!
And we've created a video to give you a little behind the scenes look at athletic training and its importance encompassing medical students and faculty as well as orthopedic clinicians. So, understanding athletic training, our objectives of the day are what basically is athletic training, our MSAT curriculum and clinical.
We're also going to talk about our interprofessional collaborations and interactions between athletic trainers and future physicians.
So jumping into what is athletic training. Athletic trainers are healthcare providers working in collaboration with physicians to provide care, and we're pretty much there before, during, and after an injury. We prevent, we treat, and rehab. This pretty much encompasses our entire goal in the profession.
There's a lot of places where you can see us work together, but we always work as a team.
Athletic trainers must learn to function in a group as they are part of a team and other professionals all working alongside each other and offer different parts of their expertise. Along with the physician and athletic trainer, there also includes their staff, any of the athletic training ATCs on staff, as well as athletic training students, PTs depending on setting, and obviously the athletes and coaches.
So as I previously said, we work in a lot of different settings, but you're going to see us in the athletic training room. That's where we live. We're in the high schools, we're in the colleges, we're at your contracted events for tournaments. We work as physician extenders, we work with the PTs in the clinic, but the biggest thing we need to know about this is we are the sports medicine team. So, who's a part of that team? Our interprofessional relationships are mainly with physicians in the sports medicine team. That relationship between the physician and the athletic trainer is vital to provide the best level of care. Research has shown that the relationship between athletic trainers and physicians is the cornerstone of the sports medicine team concept. And also we can show here that Pecha and Sniffen, they've outlined some things that physicians have reported about that relationship with athletic trainers, not only working as physician extenders, but also on just general characteristics of care, communication, commitment, integrity, and knowledge. So both of them, it comes down to the highlighting the fact that athletic trainers are useful in not only making their job easier, but just making sure that clinical operations are working as efficiently as possible, but they also value our characteristics.
And we're going to move into our programming. So curriculum and education. So athletic training, it is moving away from the 4-year bachelor's degree from the accredited program. Now is moving more into a 2-year master's program, and currently today, nearly 70% of athletic trainers have a master's degree. Our athletic training curriculum uses a medical-based education model, so very close to that of medical students and faculty. And that education model does consist of 8 different learning competencies that will be matched and hit throughout the entire curriculum.
And now in comparison to medical students' curriculum, here we have an example of a 4-year program at Harvard, which is one of the premier medical schools in the country. A lot of the learning competencies that you find in athletic training are similar in medical school. It's a 4-year program at the graduate level, so you have to have an undergraduate degree to start. And you can kind of see through here, there's lecture phases, this early part where you're learning kind of about your profession, you're learning your skills, and then it starts to transition you into more of a clinical phase. So here we have our principal clinical experience. You're just getting into the hospitals, you're getting to learn in different kind of settings, learning to pursue what you're interested in. Moving past that now, you're looking into your post-PCE phase, the post-principal clinical experience. So you're getting more experience, more professional, you're having more responsibilities in the hospital, more problem solving. And in this phase, you're also learning about advanced integrated science and population science, which is something you probably would not be able to do just jumping into the end. So it's progressive kind of education, which is very similar to athletic training. And both of them, we all have research we need to do. We all have clinical opportunities we need to engage in. And that all kind of culminates in the clinical capstone. The only difference with medical school is after you finish this 4-year program, you have to move into your residency, which is not common in athletic training. We just have to take a certification exam. So that's one big difference. So after everything, I hope that you have learned that we have similar roles, we work together, we're all on the same team, And that interaction that we have between each other, that's what's going to provide the best care for our patients, our future athletes, and anybody else who can utilize our care. Enjoy!